Good afternoon, everyone. Alzheimer's and Ayurveda. How does Ayurveda help with management of Alzheimer's? Well, we are going to talk to Dr. Alicia Sudol, who has been an Ayurvedic practitioner for the last 20 plus years. Dr. Alicia is currently enrolled in the Ayurvedic doctorate program with California College of Ayurveda. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I would like to introduce all of you to Dr. Alicia, who's joining us live from Monterey Peninsula. Welcome, Dr. Alicia.
Thank you for a warm introduction. Welcome, everybody.
Okay, so let's get started on, about Alzheimer's to begin with, and then how Ayurveda can help.
Absolutely. So let me just in the beginning to clarify between between dementia and Alzheimer's, because not all forms of dementia are Alzheimer's. So the dementia is a general category of disease characterized by steady decline of intellectual functions and other cognitive skills that interfere with daily living. And dementia can be classified as Alzheimer's and non-Alzheimer's, but most cases, more than 80% cases are Alzheimer's. That's why we use it interchangeably. But also because dementia can be due to other factors such as cranial injury or vascular infection, and not only at old age, but usually that's the major point, that it affects people over the age of 65. And what's common with Alzheimer's is the formation of plaque in the brain, right? So that we know about the beta amyloid plaque that forms in the brain, and this is the pieces of a protein that clamp together. So chemically it's very sticky, so that's why it accumulates, it clamps, and then interferes with the connection between neurons, with the communication of neurons, and also causes brain inflammation. And of course there is the neuronal loss in the cerebral cortex and subcortical structures of the brain, as well as in the hippocampus, which is the part of the brain responsible for learning new information, for memory and emotions. So that's why people with Alzheimer's have all these symptoms of forgetting and being unable, emotionally unstable. And it affects 15% of people over age of 65 and 40% over the age of 80. So it's really very, this is the costliest condition, one of the costliest condition in the nation, because in the United States itself, it is estimated that by the end of 2020, it will cost the nation more than $305 billion, and only it is exponentially growing. So with every year will be more and more cost added to the society, and also there is very taxing for the caregivers who are involved in daily care of those patients. So as for the etiology, it is unknown, but it is understood that in 15 to 20% of cases, the genetic factors play a role. But at this point, I just don't want to discourage anyone who has this predisposition for that or gene for that condition, which is called APOE4 allele, because our lifestyle choices can influence how we will be expressing our genes. So lifestyle changes can absolutely offset the risk imparted by inheriting the so-called Alzheimer's gene. So as for the Western treatment, so nowadays there is no any meaningful treatment for that condition. There is simply no cure.
So we can there's no cure for this. There's no cure for this.
No well-known cure. So unfortunately, but there are methods that can help, but there is nothing like that you can take and cure the disease. That's why it's growing, and that's why it's so expensive to manage this condition. So Ayurvedically, so how does Ayurveda approach this? So there's nothing specific actually in the Ayurvedic text about this disease, particularly about Alzheimer's, but it can refer as to the can be referred as to the conditions that affect the mind, as Ayurveda talks about. And it affects people in the Vata life of time. That means elderly. So when we have Vata, Pitta, and Kapha, right, it's also influenced not only as the constitutional type, but also there are periods in life that Kapha is when we are young, the Pitta when we are the most productive, and Vata type of life when people are getting older. So the Vata dosha is the primary vitiated dosha. So this condition affects memory, as I mentioned before, and specific sub-dosha called Udana Vayu that influences the thought process and also function of all vayus that are involved in this condition. So Ayurvedically, and also from the Western viewpoint, prevention is the best remedy. So as I said, there is no cure for that, but prevention. So I'm just emphasizing this, that as I said before, even if we have the predisposition to develop this condition, but it doesn't mean that we will, as long as we'll be living the healthy life. So, but when the condition sets on, so how can we help with that? So the principles of Ayurvedic Rasayana therapies are the most advised in care of patients with Alzheimer's. And Rasayana therapies, that means nourishing, nurturing, strengthening, building stamina, stability, building ojas, everything that brings nourishment to the body. And we can go to the next slide. Thank you. So, but the effective management with the patients with dementia is quite difficult because patients usually, of course, they have troubles with remembering names, finding words, forgetting little things, right? So they become very frustrated with themselves that they cannot function properly, they cannot find easy and perform easy tasks. And this frustrations leads to hostility. So they very often they are not cooperative with the caregivers. And that's why 80% of caregivers actually suffer depression themselves. So it's very, not only for the patients, but for the caregivers, it's very, this condition really, it's very taxing. So as I said, Rasayana therapies are paramount as with providing the deeper nourishment. And that includes external therapies as well as internal. So as the external, Ayurveda approaches with nourishment in form of, for example, giving warm massages called Abhyanga or Shiradhara, the warm, when the oil is poured on the forehead and soothes the mind, soothes the nervous system. So everything that is tonifying, that is building, strengthening. It requires, of course, time and also requires cooperation on the part of the patient. So that's why I said it's hard to manage this, and also requires a commitment and also do this quite often. So any circulatory stimulants to the brain will be very recommended and helpful, because the circulation to the brain is compromised, right? Those plaques reduce the blood flow. So that's why getting through those plaques and increasing circulation with herbs or some other supplements will be beneficial. And again, so when we are taking care of those patients, again, I'd like to mention that our lifestyle choices influence our bodies all the way down to our DNA. And we do, in fact, have more control over our health destiny than we ever knew. So it means living our lives with a choosing right diet, choosing right routines in our life that influence how we're gonna age later on. So we're gonna go to the next slide. Thank you. So as for the Ayurvedic formulations or herbs, so there is in Ayurveda classical formula called Sarasvati churna, which is very helpful for any age-related or nervous disorders that involve Maja Dhatu, that means the nervous system, which part of that, there are many herbs, but one of them is ashwagandha, which is very renowned Ayurvedic adaptogen and tonic and immunomodulator. It's one of the best herbs in Ayurveda, as well as the ashwagandha is combined with calamus, which is a stimulant to the mind. And calamus is one of the most revered also herbs in Ayurveda for the nervous system. It improves concentration, promotes clarity and organization of speech, which is very important for patients with Alzheimer's. So nervine tonics, again, ashwagandha, because as I said, so it works on a different, has wide plethora of that it can work on as for the different conditions, but as a tonic, so it strengthens the nervous system. Bala is another wonderful herb that it can be used, or kapikachu, which also is like a precursor for dopamine, as it contains L-DOPA, which also is good for Parkinson's disease. So also besides nervine tonic, circulatory stimulants will be beneficial as the basil, which is well known, not only herb, but just a spice as well. Bala, and the Bala is Sida cordifolia, and calamus, which is called Acorus calamus. So those two are actually a little different because they contain ephedrine. So they have to be taken under the supervision of a doctor, because the ephedrine may interfere with some other medications that usually people with Alzheimer's have concomitant conditions. So they have other conditions that are taking medication for, so it may exacerbate the efficacy of other drugs, or can even reduce the efficacy of other drugs. So that's why we have to make sure that people are taking those, but with the supervision of a doctor. So circulatory stimulants are very important because, as I said, circulation is compromised to the brain. So ginkgo biloba, well-known, not only in Ayurveda, but also in Chinese medicine, herb is very beneficial. So it is widely accepted that it slows down the progression of some symptoms of associated with Alzheimer's, but also can reverse and help with the early memory loss with Alzheimer's patients. Cinnamon stimulant, heating herb, turmeric. Turmeric is a wonderful herb that directly works on those beta amyloid plaques, and also it's anti-inflammatory. And also studies have shown that the doses of 50 milligrams per kilogram and 50 milligrams and 100, it can increase the protein called the brain-derived neurotrophic factor, which the protein in the brain that can respectively increase like by 78% or even 90%. So it's really very beneficial and widely researched herb and spice as well that you can use in your cooking every day. So that's yes, so this was for the herbs. Now we are going to the supplements, because also there we have supplements that can be taken on a daily basis that are widely available, and cannot emphasize enough the beneficial effect of omega-3 fatty acids, which DHA is. working as an anti-inflammatory and stimulating growth of new brain cells, which process is called neurogenesis. So, and that means fish oil, right? Widely accepted. It could be from fish and could be from algae. If someone it doesn't is vegetarian, for example. So, but it is very important to have these omega-3 fatty acids. And vitamin D. So actually, vitamin D is not really a vitamin. It's more like a pre-hormone that affects over 800 genes, the expression of those genes. So it's produced from the cholesterol in the skin when the sun hits the skin, right? And then also is synthesized in the liver. So that's why it is now, especially also during the pandemic, everyone says to have your vitamin D level checked and have enough of that vitamin to take, because it is just incredibly how beneficial it is. And unfortunately, in the United States, many people are vitamin D. They are deficient of vitamin D. So it is imperative to take it. So especially during the summer months, so we can have the natural intake of this vitamin by exposing our body for 10-15 minutes to the sun without any blockage as for the SPF. And that's why we have to accumulate more during the summer months to get us through the winter. That's why it's important to supplement in the winter, especially with vitamin D. Another vitamin B12. Again, there's so much deficiency in the population in the United States with B12, and another vitamin that has direct impact on the brain. And also not only for the Alzheimer's patient would be beneficial, but for children even with ADD or HD that are really, they need to have enough of that vitamin. B9 folate, again, another vitamin that activates 300 gene pathways in a positive way. So another one that makes sure that you have in your daily dose. And very important, probiotics and prebiotic fiber. So this is very complex ecology as it comes to our gut, right? And now this widely we know about the brain-gut axis as a composition of the microflora in our gut influences directly our brain. So, and that's why we need to make sure that we have those probiotics, that there's a symbiotic work of those microbes in our gut. And prebiotic fiber, so that's like a food for the microbes to grow, to thrive and proliferate. And it could be found in dandelion greens, in Jerusalem artichoke, leeks, asparagus, garlic, onion. So it just again comes to the diet to have enough of that you can provide the healthy flora in our gut. So now I'd like to talk about something called brain-derived neurotrophic factor, which is this is a protein. It's like a fertilizer for the brain. It's very important. So it increases the formation of new neurons, called, as I mentioned before, neurogenesis, but also influences the neuroplasticity, the rewiring brain with the new synapses, with the new connections, because very often, as I said, there's blockage in the communication between the neurons in patients with Alzheimer's. So we need to make it more powerful, softer, so that they can function well, better. And this is the protein that is naturally produced in our brain if the conditions allow us for this to produce. So it is a very important molecule. And so let's talk about how can we increase the production of that molecule. So going to the next slide, we can see, for example, what foods will be increasing this production of BDNF. So I listed one, blueberries is the number one, but in general, every fruit and vegetables that are they have a bright color. So the phytochemical compounds contained in colorful fruits and vegetables exhibit this potent antioxidant and anti-inflammatory activities that can reduce the age-related sensitivity to oxidative stress and inflammation. And blueberries are one of them. So as blueberries or red grapes, so those bright colored vegetables have this they have the polyphenols, the compound that mostly is contained in those bright fruits and vegetables. And also moreover, recent work suggests that those polyphenolic compounds found in those fruits and veggies may actually directly influence neuronal communication and signaling. So that means that it is happening faster. So there is no loss of memory or loss of forgetting things, because it just works faster and more efficient. So it appears that some of the most beneficial health effects results from the consumption of large class of polyphenols known as flavonoids, which blueberries, green tea has it, red grapes, olive oil. So all the healthy fats are very important. Not to stay away from all these hydrogenated or bad fats. Olive oil, one of the best. Avocado oil is another good one, or coconut. Dark chocolate has also this high content of polyphenols. Turmeric, I mentioned before. So the turmeric and another Bacopa monnieri herb, those are wonderful Ayurvedic herbs that work so wonderfully on the nervous system, that we can introduce and have in our lives on a daily basis. And again, mentioned before, omega-3 fatty acids. So make sure that you have enough of those. So this is for the foods, but what about activities that we can do that can increase BDNF? So what about exercise? This is like the simple thing that we can do, and anybody at any age can do this, right? To increase this protein. And so it doesn't have to be a very strenuous exercise. Like aerobic is more, is kind of faster, right? It requires more energy, more stamina, but at least 10 minutes is enough. But just a simple session of moderate intensity walking will be enough for the body to start producing those molecules that increase the brain-derived neurotrophic factor. And that's why we are saying that sedative lifestyle that it's not helpful, right? Ayurveda always encourages the right foods and lifestyle, that including the exercise, and Western medicine also talks about this all the time. Yeah, you have to exercise no matter how old you are, what age you have to keep yourself moving. And so what happens during the exercise? The molecules reduced from the muscles, from the liver, from the fat, that increase, and other agents that increase the BDNF. And also that causes the faster maturation of the neurons, proliferation of neurons. And also it can increase the volume of the hippocampus, actually, this part of the brain responsible for the learning. So, and we all know that when we exercise, then we feel much better, comparing if someone will be sitting on the couch for a few hours, right? That's no-brainer, simple like that. But we have to remind people about even simple things very often, right? Okay, let's go to the next slide. So, and in general, so what can we naturally do to promote this hippocampal neurogenesis, that means formation of the new neurons? And there's a part in the hippocampus that uh, can grow new neurons pretty much till your death, because the old notion that we many years ago people were taught in medical schools that about irreversibility of neurons, it's gone, it's not valid anymore. uh, Brain, as same as other parts of the body, can regenerate, can grow new cells. So it is more very widely documented with, for example, alcohol encephalopathy. Yeah, so someone can stop drinking, it can regenerate those neurons that were lost during the period of drinking, for example. So the same like with the taste, the buds, the cells in the taste buds, they grow every few days. The cells in our skin grow every month. There's a turnover. Even our muscles change the cells in the muscles every 15 years, the skeleton every 10 years. Even the cells in our heart, by the age of 80, our cells in our heart change 4 times. We have like a pretty much a new heart every by that time that we reach the age of 40. So the same with the part of the brain called in the hippocampus, that we can grow new cells. So, and how we can allow this to happen. So with the talking about the lifestyle, and as I was talking so much about the nutritional interventions. So simple things like that Ayurveda also for thousands of years talked about, right? So the lifestyle as an exercise, spending time with others. Don't we feel better when we spend time with others, and that we feel more connected? So unfortunately, nowadays, when people are isolated, it really wreaks havoc, and causes them even to increase more anxiety in depression. And one of those things that slows down and BDNF production actually is social isolation, as well as stress and sugar, refined carbohydrates. So we have to find a ways to manage that. So restorative sleep is very important. Not enough to time to talk about that, but this is really very important as having the good quality of sleep. Meditation, widely accepted, that can influence positive changes in our neurons and in the brain, and how it influences how we feel. So it's recommended by even medical doctors. So now that's time that it's embraced by society. Sunlight, as I mentioned before, we need to expose ourselves to sunlight to feel better. Healthy diet again, and something called like intermittent fasting. That means, during the fasting, it's not like some during the time with people with Alzheimer's cannot do the fasting, but I mean like from the evening to this to breakfast, we have the 6-7 o'clock dinner, and then no snacking. There's no midnight snack. This is the Western approach. There's enough time for us to go till morning to have a nice nutritious breakfast. So that is around 12 hours during the time that the body regenerates and provides some kind of called ketone bodies. So when these molecules are called beta hydroxybutyrate are produced, they can reset our physiology to work better properly. So simple, yeah, things like that, just to have the understanding of the simplicity and common sense as in life, as for the living a healthy lifestyle. So let's go. Yeah, so this is like the last slide, I'd like to close with um, with something compelling, something that will resonate with you, that we can change our expression, the expression of more than 90% of our genes that have direct bearing on our health and longevity. So even if we are predisposed to with the gene to have that we have the family history with Alzheimer's, it doesn't mean that we will develop that, as long as you'll be living the healthy lifestyle, including the right nutrition, plant-based mostly diet, right exercise, getting right supplements that you can offset, and even the little changes can tip the scale over in our favor. So just finishing on optimistic side, that you don't have to worry about that, as long because we have the power. The power is in our hands. That we have the power to improve operational status of our brain with the everyday choices that we make, as for what we do, what we don't do, how we respond to stress, what we choose to eat. So I just wanted to finish with that. Thank you.
Absolutely beautiful what you said, and I think it's very sad for people who have Alzheimer's now, that if they start with this healthy lifestyle, it's probably not going to get reversed, right? Because but people who are in their 40s, like you're saying, or maybe earlier than that, you start taking these healthier lifestyles, incorporating all these good food choices, supplements, exercise, and all that, they can revert, or they can delay the onset of any issues with your memory loss or brain damage or anything like that.
They can delay, or can they because, as I said, the expression of the genes happens constantly, right? So through the process of methylation or demethylation, if we allow our body, if we have, because now so as I said, this is only 15-20% of the genetics, right, that play a role, that we can have influence on, because the epigenetics is much more important. It's so powerful. And that means with our external environment, what we do, how we choose to live our life, that affects directly the possibility for us to develop the disease or not. And that happens every day with our choices. So and that's why the healthier lifestyle turns on the genes that are positive and influence the positive expression of those genes, and suppress the negative expression that would happen. But if we allow body, we give body those nutrients that are needed to express those genes in a positive way, then there is no need to develop that. And yes, by the age of when someone has developed the disease, so of course we cannot reverse it, but we can slow it down. We can make life more joyful or more acceptable for that person and for the caregiver, right? If the person is not on the trajectory to go steady slide down all the time, right? So, and I think everybody else would benefit to be in the environment of that person.
Yeah, in the case of Alzheimer's, the caregivers are so important, because, their mental health, as you said in your presentation, is so important as well, because you don't, it's like, who you hang out with, right? You become like that. And unfortunately, the caregivers, they're hanging out with the people who have Alzheimer's, which is amazing work that they're doing, but they have to take care of themselves as well.
They do, and it's very often because in the cases that severe cases, every single little thing, and the patient of who Alzheimer's cannot do, even feed themselves or go to the bathroom. So they have to be reminded and helped with every single things in their life, and it's overwhelming. The caregivers feel really inundated with that so much work that that has to be put into the loved ones that they usually care, and that's why also this number one of that the people are given to elderly people spend time in the nursery homes, because very often also the family members can just not, they don't have time, or they just can't care for them because it's too much. And that's why it's so costly, because in every on every angle, so there is the cost increasing with taking care of those patients. So as a society, we will be becoming bankrupt if we allow this to happen. So that's why we have to build now healthy society, and awareness is so important. The knowledge, the education that you can do this now, that you don't have to develop that. You don't have to become that patient that doesn't know the name of the children if you are implementing the healthy diet and lifestyle choices now, because it's never too late, but it's always, that's in your hands. That's your power to change it.
Yeah, well, thank you so much. Any questions? I see participants in Zoom. If any comments or any questions, you're welcome to ask. If you can't think of a question right now, more than likely you are a caregiver who is attending this session. If you have any comment or question, you're welcome to ask Dr. Alicia right now. We have our email, we have our website as well. If you can't think of it right now, that's perfectly fine as well. Okay, I'm just going to wait for a moment before I close this session. Okay, so well, thank you so much, Dr. Alicia, for joining us.
Thank you for having me.
Yes, absolutely. It's I think it's an amazing information that you gave, and I hope it's helpful for caregivers who are taking care of their loved ones for Alzheimer's. With that, I'd like to wrap up this session, and thank you so much for joining us. Have a great day. Bye-bye.